For more on the story, we're going to bring in Dr. Bharat Pankania now, who's a senior clinical lecturer at the University of Exeter in the UK. Doctor, thank you so much for joining us. Now, this obviously seems like very big news in the fight against the pandemic. What more can you tell us about this development?
So it's good news in a very limited and specific way. It's early days, but of course it is good news. And what the trial appears to indicate is if the medication is taken early, and the key point is early in an infection, it seems to reduce hospitalization and deaths. So far, so good. We also want to know about the side effects profile, which I couldn't work out from the preprint paper they have published. But it is, of course, good news that there is a virus, an antiviral, which seems to disrupt the reproduction of the SARS-CoV-2 virus and therefore reduce the duration of the illness and the severity of the illness, but it must be taken as soon as possible.
Now, with these companies rushing to get this FDA approval, how quickly does that mean? How quickly will they be able to get that approval realistically? And then how quickly after that might we see a rollout?
No, I think we have to do further investigative studies first. So they've done a phase 2A study on the effectiveness of this drug, which is good. We need to do a proper extended phase 3 study on this drug and look at the safety profile even more carefully now before we say, yes, we are ready to go with regards to using it with the general population. So we are some way to go, but the news is sounding promising, but we mustn't sort of cut corners.
How quickly do you think it will be until we do see a more general use of oral vaccines, if we will?
So this is an oral antiviral, and it disrupts its reproduction. And if this one, and there are other promising ones coming along as well. So I would say we are at least 6 months or so away if all the results start to line up in a positive, protective effect without causing too many serious side effects.
Okay, Dr. Bharat Pankania, a senior clinical lecturer at the University of Exeter. Thank you so much for your time today and for all your insight.
Thank you.